Hi, I'm Dr. Nick Campitelli. Once again, thanks for stopping back at my YouTube channel. And today's video, we are talking about plantar warts. As usual, we'll talk about what a plantar wart is, what are some simple things we could do at home to treat it, and most importantly, when it's time to call your doctor. All right, let's get started with this video about plantar warts. Okay, so what is a plantar wart? Plantar wart, or warts on your feet, are viral. You can come in contact with this virus as you're walking barefoot in a gym or around swimming pools. And what we theorize is these little tiny viral particles can get into your skin and they cause a wart to form. It's no different than getting a wart on your hand or cold sores, which are also viral. Those are called herpes. It's that same class of viruses. So the virus gets into your body and it manifests as a thick callus-like structure on the bottom of your foot, which we call the plantar wart. And they're called plantar warts because plantar refers to the bottom or the sole of your foot, and obviously wart meaning a wart. The medical term is verruca plantaris. So what do plantar warts look like, and how can I tell if I have one? Well, there's a couple key features that we look for, especially in our office when we're examining these warts, and this is something you can also do at home. You want to get real close and look to see if there are little black dots in your calluses. So when I say calluses, some people think a wart might be a callus or a callus might be a wart or vice versa. Well, one of the things that you're looking for are these little black dots. And these dots are actually areas of dried blood because warts have a high vascular supply and they grow their own blood vessels. And when these tiny microscopic blood vessels rupture, they become little black dots. So that's a classic sign of a plantar wart. And something else that you're going to look for that you won't see with a callus are interruption of the skin tension lines. So if you look at your finger, you have those little fingerprint lines. On the sole of our foot, we also have those lines, and we refer to those lines as skin tension lines. In a wart, you will see interruptions of these lines, and you'll start to see little, what we call villiform-like projections, or just thick, disrupted tissue, and you won't make out those skin tension lines, and that's another classic sign of a plantar wart. And you may see one of these on your foot, or you may see many plantar warts. When there's a lot of them, we refer to that as a mosaic, or a group of plantar warts. And something that's important that I get asked all the time is, are these contagious? The simple answer is yes. So if I have the wart and I'm walking around my house without shoes or socks on, I can be spreading those viral particles on the floor, and other members of my household can be walking and actually get those viral particles collect on their feet. So something that's important is if someone in your family has these, you may want to have them shower in a different shower, cleaning that shower really good with bleach, or using Lysol to spray areas down where they're walking, or just make sure they're wearing some type of flip-flop or shoes in the house to prevent the viral particles from spreading. What about getting these plantar warts on your hand? If I touch the wart that my child has, can I get this on my hand? Not exactly. Plantar warts are specific to the sole of your foot, and the warts that occur in your hand are specific to the warts on your hand. If you notice, I mentioned the word child, or what happens if I touch my child's foot. The reason I say that is plantar warts are more common in children than they are in adults. So we usually see a higher incidence of them occurring in children and adolescents. Then we start to see that taper off the older an individual becomes. That's not to say an adult can't have a plantar wart, because I do see a lot of them in adults, but it's definitely more popular and occurs at a higher incidence in younger kids and adolescents. So let's talk about home treatment. Some of the simple things you can start doing is buying over-the-counter wart medication that's called salicylic acid. You might also see wart pads out there that have salicylic acid in them, or you can buy the salicylic acid in a jar, which comes in either a liquid or a paste-like material. And what you're going to do is follow the directions on the jar or the wart medication, which will say how often to apply it. Now, when you see a physician, such as myself, I typically recommend putting it on once in the morning and once at night, and doing this for up to 4 to 6 weeks to see if we can get the wart to peel away. And obviously, I'm not allowed to give medical advice in these videos, so what you'll want to do is follow the instructions on the medication. What about freezing it? There are home kits out there that you can buy over the counter that are cryotherapy or wart freezing kits. And while these can work, It's almost as if I would say they're kind of inhumane, because you have to have that cold medication applied until a blister forms or until that skin starts to become disrupted, and it's very painful, and it's actually difficult to do because your body reacts in pain and you have to pull it away. So when do we call a doctor, or when do we go see a podiatrist with plantar warts? I always like to say, if you've tried to treat them for a couple weeks to a month and they haven't gone away, it's time to see your doctor, because if you don't get rid of one turns into two turns into four, and so on. And now, after you've waited 6 months, you might be coming in with a large mosaic of warts that we actually have to remove surgically. And that's troublesome because the post-op recovery period is very long when you have to cut out all these warts on the bottom of your foot. So this is one of the conditions where I recommend calling your podiatrist or getting in to see someone sooner than later. And what are we going to do in the office? It's a painless procedure where we typically will use a small scalpel, not a blade. We're not cutting you open. Well, it is a blade, but we're not actually cutting you. We're shaving portions of the wart down, and we're applying a little bit of a stronger acid, and then we usually prescribe something for you to use at home. And the protocol that I typically follow is, we'll treat this for 2 to 3 visits, and if it's not going away, then it's probably time to have it surgically removed. I know you don't want to hear surgery, but the last thing you want to do is have these plantar warts spread and have large areas on your foot that need cut out. The surgery is pretty simple if you're only having 1 or 2 warts removed. It's done in the office. We will numb the area. I use a cold spray to kind of make that needle less painful. We inject the wart. It gets numb. A few minutes later, we cut it out. It's all done on the same day in the office. You'll go home with a bandage and a surgical shoe. And many of my athletes are within a week or 2 back to competing. So if you're a child and you're in sports, you might want to hold off until your sporting season is over, and then it's time to have the wart cut out. All right, so to review plantar warts. They're viral, they can be contagious in your house, and a lot of times you'll get them walking around barefoot. Home treatment options, using that topical salicylic acid that you can buy over the counter, and make sure to call your doctor as soon as possible if they're not going away, or if you see more than 1 or 2 warts, because when 1 or 2 turn into 4 to 6, it's very difficult to treat, and it usually will involve surgery. So thanks again for watching. If you have any questions or concerns, make sure to leave them in the comments section below. Please make sure to hit the subscribe button and stay tuned for more videos in the future.